First of all, it's interesting. There are a lot of different diseases. There are chronic ones, there are viral ones, there are bacterial ones. Most of my work has been in chlamydia and to some degree gonorrhea. But that being said, there are a lot of opportunities to study different interventions to prevent disease. There are a lot of opportunities to improve people's health. And it's also a field where the other people who are doing research in the field, a lot of them have been in the field for a long time because they're committed to it. And STD prevention has always been relatively low-resourced compared to a lot of other healthcare problems.
And the thing about STDs is that it's about people, and it's about people in some of their most intimate behaviors. And that makes it very interesting, because while the tools and the tests, while the medicines and the tests are some of the tools we use, they don't work unless you're using them in and with people. And in fact, it's not just people as individuals, it's couples and some of their most intimate activities, and those activities interface with what goes on in our society all the time. And I think the complexity is what keeps us going and drives us more and more in the direction of this.
I thought about other career choices in terms of maybe working in the private sector or maybe working in statistical analysis, that I realized I would really miss STDs. And I think that's when it really solidified for me that this is where I should be working.
It's an ever-changing field, and it's also, as I said, it's a real human experience, because I think there are a lot of patients that I've seen with sexually transmitted infections that came in and told me things that they hadn't talked to their partner of over 20, 40 years. So you're dealing with a unique societal issue, you're dealing with unique personal issues, and you're also dealing with basic infectious diseases, and you don't really get that in other communicable diseases.
There's so many people who need our help, are grateful for it, but are not making a political statement when they come through the door seeking a test or asking a question. They just want to be happy, they want to be healthy. And we want to create an environment of confidence and trust for them, and I fell in love with them too. So I stay because that drives the work, the patient, the staff, and the need that you can see in the community. But I really don't approach it from the latest research shows us, you know, that teen pregnancy rates are falling, but STD rates are rising. I think about the people who are doing it in Nebraska, in Iowa, in Washington State, in North Carolina. I know those people, and they're the people who get me out of bed every day.
Public health offers a wonderful opportunity to really grow and develop and learn lots about the communities that you care about. And so I think it's all about following your passion, figuring out what it is that is important to you in this field, and then going with that and just being open to lots of possibilities.
But I would say be patient. Try to be exposed to as much as you can, and when you make mistakes, you know, learn from them. Don't just, you know, feel like it's a downer, because you're gonna make mistakes. But, you know, as my grandfather would say, if your heart's in the right place, won't nothing bad happen to you. You know, if your intent is positive, it will happen.
Please may I invite you to use the opportunity provided by this conference to explore new frontiers, to hear about innovative solutions, and to work with us to achieve this vision.
There are going to be a lot of obstacles. There are going to be a lot of challenges, and those challenges are going to become opportunities for you to improve and to grow both professionally and personally. So the number one advice would be to make sure that you have that fire inside, that whatever you are doing creates that fire inside of you that's going to allow you to keep on.
Be open-minded. Anything can happen when you're working with sexually related topics. I would also say be inquisitive. Also, do not accept what has been done over the years as the only truth. And keep looking for how to engage the population on these important issues.
By doing this outreach and empowering people to take their own responsibility, we will conquer the epidemics of STDs someday. It'll take a while, but it's coming.